Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's question is, how can breathing properly improve your health? And this is something that I feel like I've talked about breathing a lot on this channel, and I really think breathing is essential to everybody's health, whether it's breathing when we're stressed or breathing to actually improve our respiratory capacity for people with lung issues, whether it's breathing to improve GERD and other digestive disorders, or even simply just breathing properly to have good core stability and therefore improve low back pain or improve stability when we're doing exercise. And so I want to talk about an article that was just a narrative review. So it just talks about many conditions, health conditions that can benefit from diaphragmatic breathing. And we'll go from there. So let's look here at this guy. Okay. So the article is The Effects of Diaphragmatic Breathing on Health. It is a narrative review by Hidetaka Hamanasaki, and it is from 2020. He talks about how saying that breathing is an essential part of life, and diaphragmatic breathing, specifically breathing from the diaphragm, the muscle that's beneath the rib cage, is a slow, deep breathing that affects the brain, cardiovascular, respiratory, and gastrointestinal systems through modulation of the autonomic nervous system. Okay. The results he looked at multiple systemic reviews and randomized controlled trials, and it showed that it is effective for improving exercise capacity and respiratory function in patients with chronic obstructive pulmonary disorder, or COPD. It also improves quality of life in people with asthma, helps reduce stress, can treat eating disorders, chronic functional constipation, hypertension, migraine, anxiety, improve quality of life in those with GERD or gastric reflux disease, even cancer. So it's something that is just everyone should learn how to do, and this is why I wanted to make another video on it here. So the diaphragm, besides it having the movement of the diaphragm to help expand the chest or expand the lung volume, it is involved with vocalization and swallowing. The diaphragmatic motion in breathing directly and indirectly affects our sympathetic and parasympathetic nervous system, which is pretty cool because that's that rest and digest or fight or flight system. And so therefore we can have better balance of that autonomic nervous system with proper breathing. Diaphragmatic breathing is defined as breathing in slowly and deeply through the nose using the diaphragm with minimum movement of chest while in a supine or laying down position. So we'll kind of show you what that picture looks like here. Just breathing in to the belly by letting the diaphragm descend down into the belly, and just in a relaxed position. Now you can do diaphragmatic breathing in any position, but generally laying down on your back is the best way to learn how to do it. And how it can affect, again, the brain, the autonomic nervous system, the cardiovascular system, the respiratory system, and the GI system or gastrointestinal system. So if we just look through a little bit of the couple tables he has here, so these are the systematic reviews and the meta-analyses, and how it shows that, like, for people with COPD, it can improve dyspnea, so improve problems with difficulty breathing, improve the 6-minute walk distance, can decrease the respiratory rate, therefore you're not breathing as heavily. Quality of life was about the same. People with asthma, possibly quality of life was increased. And then there's some other stuff that was kind of negligible in these systematic reviews. The systematic reviews a lot of times looked at and let's do then this one I want to look at stress. It just can decrease stress, so there was really no health concern with it for subjects. And then if we look down here, sorry for the upward OPK for everybody, but we look at the randomized controlled clinical trials with people with COPD, again, increased that 6-minute walking distance. People with asthma increased forced capacity, the forced expiratory capacity, the pulmonary expiratory capacity, the many lung pulmonary statistics were improved. They, with patients with cancer, had a better weight gain. With people with cancer, had better quality of life. People with, and pediatric patients with constipation, improved defecation, improved hypertension or systolic blood pressure in people with prehypertension. With people with heart failure and strokes, improved functional capacity there. People with migraines decreased the resurgence of the migraines. And people with anxiety decreased anxiety and decreased heart rate and breathing rate. So again, all these things that can be improved by just learning how to breathe properly. So again, I think diaphragmatic breathing is something that everyone should learn how to do. And it just takes a little bit of time to practice. First, kind of maybe in the morning, at night, but then always kind of checking yourself while at work. Maybe setting a timer for like every hour and taking a couple nice deep breaths into your belly every hour just to kind of reset yourself. Once you start doing it and become a habit or make it a habit, then you're all of a sudden you'll like realize, oh, I'm not breathing properly, or I'm breathing into my chest and shoulders, and that's what's causing all this stress or causing a lot of tension in my neck and back. And then you can actually be a little more empowered or in control of a lot of your symptoms if you have any symptoms. So that's my talk for today. I hope everyone enjoyed it. I know it was kind of easy and a simple one, but just try. My Monday motivation here for you is maybe to get out and just start trying to breathe properly and try to make it a habit for yourself this year. If you have any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. Thanks again, and have a great day. Stay healthy.